Welcome to the Health Sciences North Emergency Department Ultra Portable Ultrasound Probe Prep and Disinfection Protocol. It starts with requesting the ultrasound probe for COVID patients from the patient's nurse or ward aide. The bucket will be brought to you or the patient's room. The contents of the bucket are the probe, the phone, the probe cover, the alcohol swab, muco, a green towel, a white towel, and wipes. When you have the bucket with the probe, what you want to do is first place a green towel on one side of a bedside table and place the white towel on the other side of the bedside table. The bucket should go at one end of the table on the white towel. Then you want to take the probe out of the bucket and the phone, place them on the green towel. And then you're going to open up the ultrasound probe cover package. There's the probe cover and the elastics. That's what you'll use first, and you'll save the gel packet for later. Then you'll put some muco on the probe head and chuck the package into the garbage. Then you'll direct the probe into the probe cover. And once the probe is fully into the probe cover, then you'll place an elastic just under the probe head. Once that's done, you'll pull the probe cover along the cord as you see here, and you'll pull the probe cover fully out to length. Now what you'll notice is that the cord is longer than the probe cover. At this point, you'll tear the box off of the plastic and chuck it into the garbage or recycling. And then to make the cord functionally shorter, you'll curl it as you see here. Then you'll give it a little pinch, make it a bit more narrow and easier to get into the probe cover. Then you'll slide it into the probe cover as you see here, leaving only a bit of the plug and cord outside the probe cover. Then you'll plug the cord into the phone, and then you'll pull the plastic over the phone. And you'll pull it even a bit further to give you some extra plastic beyond the phone. That'll allow you to twist it, maybe fold it over, make it thicker, and easier to apply an elastic to it. That will give you a probe phone unit that's entirely covered, and you'll place it on the green towel. You'll take the extra gel packet and put it next to the phone and probe on the green towel. And then the only remaining items in the plastic bucket will be an alcohol wipe for the phone and ultrasound wipes for the probe itself. And then you'll head into the room with the side table and all of the gear on it, keeping the side table at least 6 feet away from the patient. Now this brings up an exception. If the patient is in a small room such that you cannot keep the side table at least 6 feet away from the patient, then you'll keep the side table just outside the room and you'll only bring in the probe phone unit as well as the ultrasound gel. Then you'll go ahead and scan the patient. Once you're done scanning, then you'll chuck the gel packet into the garbage. And then you'll put the probe phone unit onto the green sheet, which now by definition has become dirty. And then you and the side table with all the gear on it will go just outside the patient room as per hospital protocol. You'll then doff all of your PPE. You'll do your hand hygiene. You'll put on a new set of gloves. And then you'll go ahead and remove the probe cover from the probe and phone. You'll start by removing the elastic from the phone end of the probe cover. You'll let the phone drop onto the white towel gently and get the cord to do the same. Then you'll direct your attention to the probe end of the probe cover. You'll milk the probe down a bit from the end of the plastic. That'll give you something to grab. And then you'll hold on to the end of the plastic and use gravity and a bit of jiggling of the plastic to coax the probe and the cord down. And then you'll get the probe and the cord to gently fall onto the towel, the white towel, and don't let the plastic cover, which by definition is now dirty, touch the white towel. Then you'll place the probe cover into the garbage. Then you'll take off your gloves, do hand hygiene again, put on a new set of gloves, and then you'll use the ultrasound wipe from the Ziploc bag to clean the probe. Once you've cleaned the probe, you'll let it drop into the plastic bucket and allow the ultrasound wipe to slide along the cord, cleaning it. Once you get close to the end of the cord, you'll unplug the plug from the phone, let all of the cord drop into the bucket, and then you'll change up. You'll get rid of the ultrasound wipe and you'll use a regular alcohol wipe to clean the phone itself. Once the phone is clean, then you'll place it into the bucket with a probe. And then if you have any remaining bits of gear, you'll place them either in the laundry or the garbage. Then one last time you take off gloves, you do hand hygiene, and then you advise the nurse or the ward aide that you're done scanning, you're done disinfecting the probe, and that's it.